Okay, it's 6:30. Let's call the meeting of the Health and Human Services Board to order. Roll call.
Dale Schleter,
Yep.
Reed Schumann,
Here.
Dale Olson,
Here.
Here.
and Don Pettit. Lorraine Gouget. Here. Carol Pearson.
Yes.
Sabrina Dunlap. You have a quorum.
Okay, thank you. Certification of compliance with open meeting laws.
The meeting has been noticed to the public and news media as required by section 1928(4) of the Wisconsin statute.
Thank you. The agenda.
I move to approve, Mr. Chairman.
Second.
We have a motion and a second. Everybody in favor, say aye.
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 Thank you. Public comments. Do we have anybody from the public here tonight? Motion to proceed. Anybody online from the public? No. Okay. Approval of minutes from last month's meeting. Of the minutes?
Or is that the agenda? We approved.
Agenda.
Agenda.
Motion to approve the minutes.
Okay,
Discussion.
we have a motion. Second. Second.
One, in discussion though, Julia, in the minutes it says the Delta variant remains the most prominent variant in our county. Would that have been true in December?
In December, yes.
Okay. Thank you.
Everybody in favor of approving the agenda? Now you got me doing it. It's easy enough to confuse me, people, don't. Okay, everybody in favor, say aye.
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 Dale,
Oh, Olson, okay.
I'm sorry. Oh, Chuck?
When roll call was going, the sound was kind of messed up. I just, for the record, I want to make sure you know I'm here.
Yep, we got you.
Thank you. Municipal code update. What's happening with that?
Mr. Chair, I can talk about that.
Okay,
The link for the new ordinance codification is in the packet and has been on every committee agenda. And I've asked the department directors and their staff and the county board members to review the ordinances under their purview, just to make sure that everything is in there. Again, there's not supposed to be any substantial changes to the intent of any ordinance. It's a matter of organization and structuring into a code of ordinances. So please review that. And if you've got any changes, I know that Julia had forwarded some comments and we're looking through that. But other than that, in this area, either contact myself or the county clerk and we can make sure that everything's in order. Thank you.
thank you.
Mr. Chairman,
Please.
Julia, what were your comments?
Article 3 and Article 4. Article 4 replaced Article 3. And so we don't want that to be approved with both of those in there. There might be some things that
Good
contradict one
catch.
another.
Yeah.
And then there was, I'm not sure if this will be able to get updated, but temporary was used in Article 4 as a adjective to describe, and transient is the wording that is now used in code. So,
Great.
Could you use the microphone when you speak,
Oh.
please, Julia?
yes, I'll come up. Thank you.
And I've, part of our retention schedule is in there, and I just want to make sure we know which retention schedule is most correct.
Perfect.
Okay, any more comments on the municipal code? Moving on, committee reports. Lauren, you wanna-
Concealed.
Oh, I'm sorry, Lorraine, please go ahead.
But I'm sorry I haven't been here as much lately. I've had a lot of death in my family and actually in our whole community. So there's times that we need to be with our people and they're grieving.
I understand.
So-
Sorry to hear.
Can you hear me?
Mhm.
Okay. But I do want to give an update though, because I gotta get re-engaged now where everybody's at. So I'm gonna start off with our update from our health director. For the week of January 10th, 22, 2 days of the LCO Health Center tested 88 patients for COVID-19, 39 positive. LCO currently has 99 active cases of COVID-19. 23 of these positive cases of COVID-19 were tested today, which is a new daily high. This represents a 43% positivity rate. On the week of January 4th, 22, the LCO Health Center tested 165 patients for COVID-19, 55 positive cases. This represents a 33% positivity rate. For the week of December 28th, 21, the LCO Health Center tested 122 patients with 50 positives. 3 days work week that week. This represents a 40% positivity rate. COVID-19 is spreading at a high rate. It is imperative to get vaccinated. According to November 2021 Wisconsin data, people not fully vaccinated were diagnosed with COVID-19 at a rate 5 times higher than people who were fully vaccinated. People who were not vaccinated were hospitalized with COVID-19 at a rate 11 times higher than people who were fully vaccinated. People not fully vaccinated died from COVID-19 at a rate 12 times higher than people who were fully vaccinated. LCL Health Center has scheduled COVID-19 vaccinations on Mondays and Tuesdays from 1 to 3, all day on Wednesday, Thursdays and Fridays from 10 till noon. Then you can call 715-638-5100 to schedule your vaccines. The LCL Health Center has vaccinated over 4,500 patients. And want to remember to follow CDC guidelines to prevent the spread of COVID-19, including wearing a mask, one within 6 feet of another, except in your own family home. Avoid large gatherings, social distance, disinfect regularly, and use hand sanitizers. That comes from our health director, Gary Gerard. So that was update he gave us. And then I also wanted to update some of the programming facilities that we have operating right now. We do have our men's shelter. I think we had like 9 men residing in there at this time. And then we do have we've changed our women's shelter to like an emergency shelter for women and their family for part of the wing that we have. So it could be a father, mother, and child, or mother and child on a wing with the women. So we're trying to meet more of the need that we're seeing with the people. And we're bringing more of the services that they need, or the resources that they need to make that connection more, so more of them are getting the help they need so they get healthier. There's reasons why people end up being homeless. And so we want to address that, try to help them in ways that we can so they can become more self-sufficient and go in the right direction again. We are looking at trying to establish a transition home. We're still working on that to make that happen. Because we do see the need for those who are coming out of treatment, those who are coming out of the system that need a place. And we're not sure if it's gonna be all men. We're not there just yet. And we also have another need, and I think the county does too. Those who are sex offenders, there is no place. They do not call, they cannot be in low-income housing. They don't, all those doors are closed real quick. So there's certain things that we're working on to try to address in the community. We continue to provide the care that we need for those who are battling addiction. Our addiction specialist now is seeing 100 patients. So she's working with different programming and ways of trying to help them and pulling more staff in to help with that. And then we still offer our people ways to get the treatment they may need if they need that care. So we're working on it. We're trying to continue to work on those issues because our people are dying. And the one thing too, I wanted to make note at this meeting, I know we're looking at all the addictions, but alcoholism, that's been mentioned a couple of times here too. Alcohol, it's always been there. It is still there. We need to not overlook that piece either while we're looking at all these other things that we're trying to address. And we're trying to help our people all the way across the board. We're trying to educate more. So I know our club is trying, Boys and Girls Club, trying to have programming for prevention. We're trying to educate more. The schools are working with us. We're trying to bring our counselors into the schools, both the tribal and the public school, so that the kids get the services they need, either for mental health or if they're dealing with some kind of loss or some issue, whatever it is that they might need the extra support with. So we're trying to build on those services for them. And the schools are trying to operate the tribal school. We mandated the mask wearing from day one. We continue that. And we're trying to vaccinate our people as quickly as we can. And now that it's been approved to go younger and younger, we're trying to reach that population as quickly as we can. I think that pretty much covers it. Don't it, Peter?
Well, I think you could talk about our vaccine mandate too, for like Head Start and things like that we're looking at coming.
Oh, those are coming in place. We already we mandated our clinic a few months ago. And there are exemptions if a person needs that. However, they have to have certain masks, that N95, and be tested twice a week if you are not vaccinated. That was implemented in our clinic. Now we're looking at putting it more out into our other departments. So, and we're trying to keep educating, because those who are influenced by looking at those vaccines in a negative way, we're trying to educate them the seriousness of this pandemic and what we have to do, what we need to continue to do to help save lives. I know our college went virtual, I think, for 2 weeks, and they've been using these safety measures all along also. So, but that pretty much sums it up. But
Yeah. I would think so, although the tribe has yet to hear about the opioid settlement, which the
Yeah.
county's getting money coming down now shortly. So I've been talking to our attorneys. We haven't heard anything for the tribal, because we also joined in that lawsuit. And it must be coming later than the county said.
Did the counties get their money yet?
The lump money's coming. We talked about it, but
Yeah,
Tom is, we're making plans for that.
and our women's domestic abuse shelter has been up and running. It's been refurbished and
Good.
Oh, yeah.
Did you say that your domestic shelter also had housing for families?
yeah, we
Yeah.
expanded that because we were seeing a need there for a parent to be with that child.
Yeah.
And we have COVID, oh, the other thing, we have COVID homes for families and single units. We have
Quarantine homes.
quarantine homes,
Good,
emergency shelter. They're also
good.
for single family units and family units. So we have a variety of sizes. Throughout LCO, we've got different sites. So we're trying to house as many people as we can. We've got this many positive cases. There are those who do have a home and can be quarantined there. Then we try to give them the food they need and the things, supplies that they need to get through that time.
Can I ask a question? Okay, suppose one of the adults comes down with it and there's children in the home. Does the whole family get quarantined for the length of the disease until everybody just clean, or how does that work?
Well, we've been, a couple of things. One, sometimes they're isolated within the home and they're taking all the precautions around. Sometimes we get them out of that home, depending on the age and who's at risk and who's,
Okay,
then we get them out of that home, or vice versa, get the family into a safe place, or the members who need to be in the quarantine home that we have.
yeah,
So it depends on the situation.
yeah.
And so we try to do things as quickly as we can. Like you said, these rises are coming up fast, and we're trying to address things as quick as we can. So
And the housing use, the shortage for housing is for
It's real.
everything, for everything.
yeah,
Yeah.
we're trying to address that. We are with the tribe. We're trying to find ways to address that, because low-income housing is one thing. But you have those who don't qualify. Then you have those, they're working, they're doing things, and they want to be, going down that road of being self-sufficient, and we want to help provide more opportunity for them. And we're trying to take care of those who need more support, because some can't be in those houses. So the tribe is trying, we're taking steps and measures to address that. So,
Any questions?
I think she did a real nice job.
Thank you.
I'm glad I missed everybody, by the way. But,
I'm sorry for all your loss.
yeah, it's been a tough year, I'm telling you, for a lot of our people.
Of all the people that you were talking about that you have vaccinated recently or tested recently, you said a certain number of them tested positive. Were they vaccinated or
There's-
unvaccinated?
The ones that we're trying to remind them to get that booster when that time frame comes, get that first, that second, that booster. And we're trying to remind them of that because some forget, some don't realize how fast it goes. So, you know, what I mean, the importance of that so that your immune system's stronger. So we keep trying to educate people on that line. But the positives, that Omicron, one that's coming through is coming too fast. And even if they're vaccinated, some are getting that, but they're not getting as sick. We're seeing them coming back quicker. It's the ones who aren't vaccinated that we've lost now. The ones that have died are the ones who were not vaccinated, and they, for whatever reason, were influenced not to. So those are the ones that are the most critical. But we're trying to address that, and we've had a lot of times where the families were coming together for the funerals and coming together, you know, and we try to do things as safe as we can, but families were coming together, so you don't know where they were coming from at times.
Thank you. Very, very good. Okay. Senior Resource Center.
Here, Dale.
How you doing, Joy?
How are you?
Good.
Okay. All right. I'll start out right with my most desperate need right now. Right now, we are in desperate need of Meals on Wheels drivers, especially in Hayward. We have 4 routes right now with an average of 72 home delivered meals going out every day. I'll give you an example. We were short drivers on Monday, so I took a route. We had today covered. Now tomorrow we're short 2 drivers, so I will do 1 route and I'll have to pull someone out of the kitchen, which isn't really easy because right now we have our site manager in Hayward who is out because they're isolated because of COVID. So we've had, since November, we've had staff either isolated in Hayward because of family members having COVID or the individuals having COVID. So this week we are short a site manager in Hayward. So that means I go upstairs and we have a volunteer that comes in. This week we had the site manager in Excellent out sick. So that meant that there were no meals that went out yesterday in Excellent and Winter. So Barb Appleby handled that situation and called everybody. The bus right now, we've had to limit our schedule to a maximum of 25 rides per day with a 24-hour notice because we have 1 bus driver and the bus typically runs 9 hours a day, 5 days a week. We did have a substitute driver that drove on Mondays, and when Bob needed to go on vacation, he has since sold his home as of today. They closed on their house and are no longer in the area. About 6 months ago, we lost our bus assistant. They have not been replaced. As everybody knows, everybody's dealing with a lack of people to fill the positions that they have. So the bus is a max of 25 rides a day, 24-hour notice if they can. That's Monday through Thursday, the 25 rides. And Fridays, we're only running the bus from 9 to 1. And right now, this week, we're maxed out for the rest of this week, and we're maxed out for part of next week. We probably have maybe 1 or 2 days next week that we can, put a few people in. What is the biggest thing that we use the bus for right now is the seniors grocery shopping and medical appointments. Medical appointments probably being the top thing, and then it would be the grocery shopping, and then other things like taking them to the laundromat to do their laundry, or bringing them to the senior center for lunch. But we're very desperate for Meals on Wheels drivers in Hayward. We need to fill that bus position. We definitely need an assistant cook in Stone Lake and Exlin. Both Stone Lake and Exlin have been working extremely hard. Right now, every other Wednesday, Chris has had to change her breakfast menu. Right now, it's getting harder and harder for us to send a cook from Hayward down there on Wednesdays to help with breakfast, that Chris is having to do the breakfast, get the meals ready for the carryouts and the home delivered. Jen is covering all the meals for Exlin and Winter right now. And we still have not found a site manager for Winter. We had someone that was very, very promising. I talked to her on the phone, sent her an application. I've called her several times for an interview, and she's not responded. So if anybody knows of anybody out there that wants to work with seniors, wants to do Meals on Wheels, be an assistant on the bus, an assistant bus driver, whatever, please have them give us a call. I do have some kind of good news, the janitor. I have 2 people that are interested in the janitor's position. One is someone that can only work 2 days a week from 2 to 4, which is kind of okay, but not what we really need. But I have a gentleman that came in today that's 82 years old, whose background is janitorial work and would love to come to the senior center and work. So we're going through different things now, his background check and stuff like that, and then we'll interview him next week. So hopefully that works out, and we'll at least have a janitor, so that'll kind of loosen up some of the things that they have to do in the kitchen as far as mopping the floors, buffing the floors, different things like that. We do have a volunteer that comes in every Tuesdays and cleans all of our bathrooms for us. So, but anything, I guess I can't stress enough, the greatest need that we have right now is for Meals on Wheels drivers at all sites, but mostly for Hayward right now. Okay, at any given time, we have 1 or 2 routes that need to be covered every day. And it's okay once in a while for myself or another staff member to come up from downstairs and go deliver meals, but we can't do it, every day, especially since November, when we've had so many people out sick that we've had to, pitch in wherever. If you heard any complaints about the meals in November, it's on me, because I was the cook most of November, but hopefully nobody complained too much. But I will say, last week we had ribs, and when I cooked ribs in November, my ribs were better than the sub that cooked them this last time. So anyway, I probably, like I said, there weren't too many complaints about my cooking in November and part of December. Some other good news is one of the issues that we've been having and concerns that people have is our website. I am in the process right now. I'm working with Todd Miller at Complete Computer Solutions. We are working on that website, and hopefully it'll get up sooner than later. I'm sending things to him, so hopefully that will happen real soon. We are purchasing Zoom equipment. I've been working, Mike Colson gave me some good recommendations. I'm in the process of purchasing that stuff, and hopefully by our February Senior Resource Center board meeting, we'll have all that up and running. We're using funds from our fundraiser bingo that we do every Monday night to not only pay for the website creation, the Zoom equipment, and also we had some computers that had to be upgraded. So we're using our bingo money, fundraising money, to do those things so we don't have to find the money in our regular budget. Our GUAR plan of work is done for 2022 and 2024. It's in the final revisions and corrections. Some things that needed to be changed, or some suggestions from the public hearing, and some of our board members that have made suggestions, corrections, or whatever. So those are in the final edits, and the final plan will be available at our board meeting next week on January 19th. I've got, I don't know if you want to call them fun facts, but some facts that I put together for our meal site counts for this last year. From January 1 to September 30th of 2021, the average cost that we were charging to make our meals was $8.55. From that time, January 1st to September 30th, we served 24,801 meals at $8.55, which amounts to costing us $212,048.55 to put out those meals. Then from September 1st through the end of the year, December 21st, a 6-month analysis was done for our meal costs. That includes Meals on Wheels drivers payments, the food costs, staff time, all of that. It was only a 6 months analysis because that's all that GWAR asked us for. That analysis came up to $10.49 that it cost us to put those meals together for 6 months. So that was 8,657 meals at $10.49, which amounts to $90,811.93, with the total meal cost for this last year. And all of our numbers aren't in yet because, like I said, we've had some site managers out sick, so not all of our numbers are in and accurate yet. But approximately $302,860.48 for the 33,458 meals that we served in 2021, with the total deposit donations that we took in. This does not include the money that we get from iLife and Inclusa, because those numbers aren't in yet for December for Inclusa and iLife, and are not in because there are some issues with them. Right now, we were talking with them today. There's a couple months that they didn't make payments. But our donations for the meals that we got for all those meals was $102,024.55, which is about a difference of $183,000, $103.19. So then we make up the difference with our county funds, our donations, and the other things that we do, and the food that we get donated from the food pantries, the food shelves, different things like that. So that's just the food end of it. That's not any other staff costs. Jody, the health promotions, Barb, the nutrition director, all those different kinds of things. That's just our food budget. We get about 53 cents per meal from our GWAR for our Title III money, which amounts to $17,732.74. So that's where I come up with $119,757.29. And that's where the difference of $103.19 comes in. So that's what it costs to serve this last year, the 33,458 meals that we served. And I would say on the average right now, we're probably just in Hayward alone, there's 4 to 6 new Meals on Wheels participants every week. So our numbers range anywhere from 68 to 72 meals that go out every day, just in Hayward. So we average between all of our sites about 133 meals per day.
Okay. Any questions for Joey?
Joey,
Yes,
those drivers, those are paid positions, right?
yeah, 50 cents a mile. And I would say about half of our drivers do not send in a mileage sheet or turn in a mileage sheet and put a note on it and say, I don't want mileage, donate it back. But they're paid 50 cents a mile. Our board has discussed raising that, but it's not, in the budget right now to raise that. We're looking at raising the Meals on Wheels drivers and our staff also. And just the staff alone, the finance committee did kind of a spreadsheet and looked at it, and we're looking at between $60,000 and $65,000 just to raise staff wages to bring them up comparable with other positions like theirs. And they also get a meal too, Lorraine, besides the 50 cents a mile.
What is your criteria?
They have to have a car, they have to have a driver's license, and they have to pass a background check and have insurance.
Okay. All right. Thank you, Joey.
You're welcome, Lorraine.
Anything more for Joey? Thanks, Joey. See you tomorrow.
Okay,
There's a memorandum.
Well, I was gonna ask Tom if he wanted to present that.
I think Paul's got that one.
You have one, you, Paul?
I guess I have it.
Okay.
Tom, a while back, sent me a draft, I think he got from Joey regarding an MOU, the SRC in Sawyer County. I looked at it and I said, I think we need to run it past Lori Perlich first to make sure the language is all what we would like. So we revised it. I sent it back to Tom and I guess it's good to go now.
can I ask you what you changed, Paul, because
Well, the one I sent, I don't know if Tom sent that to you, but we color coded what was changed. A simple one was just spelling out the acronyms.
okay,
And Lori's online, and she made those changes to see if Lori, remember what you changed on that MOU? I would have brought the color coded one if I needed it tonight, sorry.
I think we just clarified who the agreements were between, to specify that it was between the Sawyer County and the Senior Resource Center opposed to the ADRC or the County Health and Human Services Board. I remember that being one of the changes.
okay.
The other change was related to something to do with the when you would appear so that it corresponded with the actual meeting schedule. I think you had it more to specific dates and
Mhm.
just changed it to the wording to whenever the Health and Human Services Board was meeting.
Okay,
So nothing real substantial or
no,
moving?
Just clarified some points.
Does that
that's
sound-
fine.
Okay.
I'll show you.
Can you see the highlighted areas now, Joey?
Yeah, I do, thank you.
Okay, we need to pass this. Does anybody have
Yes, I
any-
have a question, Mr. Chairman. It says the Sawyer County Clerk will provide, what, a deadline? Senior Resource Center will provide a monthly written report to the Health and Human Services Board by the deadline established by the Sawyer County Clerk.
I mean, we have a deadline
We
for
have a-
everybody.
We have a deadline?
Everybody's got a deadline.
Very clear on her deadline.
Oh, okay.
Very clear. Sharp.
All right.
It just seems to me, I mean, this is all wonderful, but when we say we agree to do the following, that means you're gonna do it. And sometimes you can't do it. We agree we're gonna bus people within 10 miles of Hayward for shopping. Sometimes you can't bus people for shopping. Shouldn't we have some kind of weasel word in there?
Dale, that wording is in there because that wording is exactly what we have in the 8521 grant that we write yearly. We have to have a radius in there of what our service area is.
And I understand that the service area, I don't have any problem with that. But this says you will. It does not say we will try to, it does not say we'll make our best effort to. So somebody with a physical disability that wants to have recreation, which is what we're listing here, they want to go to the bowling alley, somebody's got to go and pick them up with a bus.
Yep.
That's what you're agreeing to do by saying that. And I don't think I think there should be at least some kind of language to temper that.
Well, Joey,
Yes,
I understand what Dale was saying. I think in times past, there's blizzard, obviously it's not going to happen.
Right.
There are, a tornado goes through Hayward, it's not going to happen. And I think the usual practice has been common sense. If there's a pandemic, it's not going to happen like it should, we would like it to. I suppose we could try and change it.
I'm just looking at one word, instead of just, we agree to do the following. Let's see, what's a synonym for attempt?
Make every effort. There you go.
Yeah,
That, that does it for me.
yeah.
I just don't want to have that come back and bite us in the tuchus, or somebody complains
Right.
because I wanted to go bowling and they wouldn't get me. Because it does say recreation right in there.
Well, I'm not sure what to think. Part of me says if we're going to do this, we better get a lawyer to help us with the wording so we are truly protected. And at the same time, I'm reluctant to get a lawyer involved.
Well, it'll
because
get a lot
it's-
longer if you go.
Yeah.
I'm just looking up here. Oh, Endeavor?
That's a much better, yes, yes. If at all possible, endeavor is a good word.
Well, since this is between Sawyer County and the Senior Resource Center, does GUAR have anything to say about how this is worded, Joy?
They do, and this template was developed based upon, samples that GUAR gave me.
Well,
I
maybe-
mean, I most certainly can run this by Pam and John. If we want to change, in 4 there, the Senior Resource Center will endeavor to provide, the following. I can run that by Pam.
Instead of
And John.
agree, the second paragraph where it just says, we agree to do the following, we endeavor to do the following. It doesn't hold us to any kind of absolute certainty.
Liability.
Yeah.
We've always got liability.
Okay, well, Joy, if you could run that by those people and then let Paul know what the result is,
Okay,
we could take this up next month.
Well,
okay, that's fine.
if you're in a hurry for this, I could make.
I don't
No,
think-
we're not. No, we're not in a hurry. This is something that, when I started this position, we looked and looked and looked. Paul looked, I looked, everybody looked, and we could not find an MOU. And this is one of the things that, the county and GUAR was asking and requiring that there be an MOU between the SRC. I'm past the deadline of when GUAR wanted this. So, I mean, there's not a timeline. So let's get it right and make everybody that they're comfortable with what we're saying and what we're doing. So no, there's not a timeline that says we have to have this done in 30 days or 45 days. We have time.
Thank you, Joy.
Thanks, Joe.
You're welcome.
Thank you, Dale. Okay,
You want a motion to postpone then for a month or?
no, we'll just do it.
Okay.
Favor.
Where are we?
Administration.
Admin, yeah, go ahead, Paul.
Under administration, I want to talk a bit about the empty site of Oasis. Tom and some of us are having discussions about a potential use of that. And one of the ideas came up, the day after it was vacated, Tom, myself and Tim Hager went over there. Tom goes, what could we use this building for? I didn't hesitate. I said, ADRC. ADRC, the adult long-term care unit, because of the layout and what I knew about it. So I don't know how many months it's been since that. So we've had on and off conversations. There's committees, boards, whatever, we've been talking about it a little bit. And so we've had more conversations about it lately. And Tom wanted to know what it would look like. And we talked really closely with Julia, and because it would impact her unit, and talk with Lori, the long-term care unit supervisor. And because we're really cramped for space in Health and Human Services. So I got a floor plan, and we talked about where would everybody go that's still here. And then that would end up with, we looked at 4 offices being open, which is good for overflow for LTE and when we have interns and stuff. Specifically, why it would be beneficial to have by the way, it's the ADRC of the North and Adult Protective Services. And I'm going to pass it on to Lori in a second here to have her explain why this is a better place to have the ADRC, especially when we have an aging population. Also, it helps out with, I should back up here. And it's on the next section, but I want to mention that we hired a dementia care specialist / information and assistance specialist because our county was given money to hire a DCS, dementia care specialist. And one of the things involved in that position, and Lori will talk about it, is they have to do some live presentations and training and stuff. And there's a lot of room there to do that. Also, Julia reminded that's on the county health plan or the county health plan. And also respect to Julia, her staff is dispersed throughout our department. She's got 2 staff upstairs and there's not enough office space. If they were to leave, we got it mapped out where they would go. So I think the first thing we need to do is have Lori explain to you how it would be beneficial to have the ADRC and APS over there.
So for those of you who aren't familiar with the history of aging and disability resource centers, one of the goals from the get-go was to be a warm and welcoming environment. Per our contract with the state, there were specifications that there should be reception areas that are welcoming to the people who are coming to visit, where people can come in, have areas where they can talk, have easy access to resource areas and to answers, whether they want to speak with a staff member or not. Because of the way the courthouse was set up and where offices were located, the ADRC of the North Sawyer County branch has never been able to meet that goal of being warm and welcoming. We are behind locked doors. And again, this is nothing in regards to what how the county building is. It's just that's the space that was available when the ADRCs were introduced. So we are basically out of compliance with our contract by having our area the way it is set up. Our resource area is behind locked doors. People cannot easily access the information. They need to talk to somebody anytime they want to be able to get information. We have a fast growing elderly population in Sawyer County. We have almost 25% of our population is 60 and older. With this last governor's budget, it included funding so that every county in the state will have a dementia care specialist. They are also pushing to have more dementia-friendly opportunities through the ADRCs, more training through the ADRCs about dementia-friendly communities, training about what dementia is. Part of the ADRC of the North's Dementia Care Specialist plan for 2022 is that a program called Dementia Live will be available in each of the 5 counties. Now, Dementia Live is an interactive opportunity for people to learn and experience what people with dementia have to deal with on a regular basis. They use specialized equipment to help other individuals understand what a person with dementia may be experiencing, such as limited vision, lack of tactile hands-on experience. I don't know if any of you have seen or worked with people with dementia, but a lot of times they'll put on big rubber gloves and tell you to pick up a coin. That can often be what someone with dementia is experiencing, depending upon the type of dementia we're dealing with. So we have a lot of opportunities to have community involvement, presenting different experiences to our community, doing caregiver training, doing support groups, but we don't have the space where we're at this time. We don't have a dedicated space that we can use on an ongoing basis. So a location like that is ideal for people with disabilities, and for the elderly, it is totally handicap accessible. There are no stairs. There are no elevators that people have to navigate to actually get to the ADRC. We would be able to have that warm and welcoming environment. And we could do more of the outreach that, particularly through the dementia, but even for the elder benefit specialist would have a room dedicated for things like doing Medicare trainings to a group. Right now, a lot of the EBS program, elder benefit specialist program on Medicare is one-on-one. Simply because we don't have that type of an environment where we could have a classroom set up where she could bring in 20 or 30 people and do a welcome to Medicare presentation. So there are a lot of pros for the ADRC to be in a location like this.
What are you asking this board here tonight to do?
Tom just asked me just to let you know the conversation is what he and I have been having with the staff.
I think it's a great idea. It's a real
Yeah, it is,
possibility. Could we just have a motion to give to property and airport or something, and or just let Tom handle it from this point?
Mr. Chair.
Go ahead.
Yeah, thank you. Yeah, I think in talking with Paul and the staff, we've met and talked with, the support staff, Julia, Lori, Paul, just talking about how it benefits the different service areas that we currently provide. And I think it does solve a lot of different issues that we've just kind of learned to live with. But now that we've got a little bit better space to utilize to provide these services, I think it's a great way to continue to provide those services at a higher level. We did lose the services of Oasis in that building, but I don't think that was working out anyway. But what we are providing, we can do a better job at under this scenario. So it's just a matter of rearranging where staff works. It's not increasing or decreasing budgets or anything else other than providing a better environment for the services that we are providing to the citizens. So we did meet in Public Works about the building. They elected, not to consider selling the facility. I think this would be a good use of it. If we come up with a better use for other services or whatnot, we can certainly entertain that at any time. But I feel that this is the best use of this space, of all of our spaces, the county courthouse and the former Oasis side of the building. So, we've got a little bit more homework to go through to make sure, some things like the network down there and the phone system and the furniture, the office furniture. So we've got some things to think through yet, but we wanted to, give you a heads up that this is the direction I think that would work more efficiently for the county.
Okay, so you probably don't need anything from us, and that's okay. But just a question, do you envision this taking up the whole building?
That's what I was gonna ask.
That portion of the building, yes. Between, Julia's functions and Lori's functions, I think that would use up that side of the building.
One side.
Northwest Journey is going to rent the other side for 2022.
Right.
That's what I was
Okay,
wondering.
yeah, that's occupied this
That's
year.
good. Mr. Chairman, I got a question for Tom.
Go ahead.
Tom, did you say that this would probably be budget neutral then?
Well, we're not adding any services, or requiring any additional funds. We may need some dollars for some office furniture or network setup. So there may be some expenditures. So that's one of the things that we have to work through. Those would be one-time expenses, not ongoing expenses. And then we may be able to recapture some revenue, if we charged, that department rent and recaptured that with some federal dollars. We're looking into that to see if that's reasonable and allowable.
I think Patty said that if we charge rent, the county can claim 40% of that from feds. So,
Really?
yeah.
And then Julia, your department would take over then where they vacate? Is that what you're thinking?
Yep, so downstairs, my staff are kind of all over the place, so we'll kind of take over that section there and have them all in one area. And then testing, or actually vaccines are going to be coming back to the courthouse because that's going down. So work can start. We are going to continue testing, but we just use a front office there and the parking lots. So, if we're able to make some decisions and move forward, that space is available for the work that would need to be done.
I don't know who to direct this to, but I kept reading about the guardianship. Would that be a training that would be also offered through the agent department, or is that something that has to come out of? Because it seems like that would be a good space to do that type of training too, and you could do a group to get that started. I don't know where that fits.
Well, Lori, did you want to speak to that?
So I'm wondering, are you referring to the requirement the guardians are trained?
Yes.
At this point, we're not having any direction from the state who will be responsible for providing that type of training, where that will be coming from. A lot of those are activities of the court, but there certainly would be a space available that something like that could be held, either for other agencies even to come in and provide trainings that might be of interest to the elderly populations and their care providers.
Right, because that would be the elderly and disabled and necessary.
And does anybody online have any comments? Yeah,
Just a quick one. Did I miss somewhere? I thought we were talking about veterans going in there.
Pardon?
Veterans service office, going into that side.
that was a possibility.
Well, here's my issue. I think both veterans as well as Lori's outfit here are both cut out of the same cloth when it comes to, it's a different subset of people than maybe using the rest of social services. And I know sometimes there's a stigma about it. I don't want to see veterans, have to come to the social services wing to get their stuff done when they've been so used to having their own building. I wish we could put them both out there, veterans as well as ADRC. I think that would be the best, but that can't happen for at least a year. So I know it's not under the purview of this committee, but I think it's important to remember that it's not first come, first serve. Those people both are, they're similar in their missions of helping a specific subset of people.
Okay. If there's nothing more, we'll move on.
Okay, the adult long-term care report. In a moment, I'll have Lori take you through and talk about the guardianship policy, and there's some comments in here about that related to adult protective services. And the other comment I want to make, and I alluded to it a little while ago, is we did hire that dementia care specialist / INA specialist. So they said we were in a information assistance specialist, that we were in the process of doing that. Well, it's confirmed. She started today. Joni, and Lori, how do you say Joni's last name? I heard it once.
Zachary.
Okay. All right. Zachary. Sounds so bad.
Exactly what it-
Exactly what it sounds like. All right. Lori, could you take us through the guardianship policy and the utility of it? How we got here?
I don't know if that's clerical there.
So we had learned through regional meetings of adult protective services that several counties are making efforts to, for lack of a better word, divorce themselves from being the go-to when it comes to a guardianship. Per statute, there's no requirement that the county be the petitioner. Anyone can petition for guardianship. It can be a facility, it can be a family member. So based upon that, And because there is no funding source for the county when we are involved in guardianships, and because of our staff having other responsibilities, which is to investigate and assist with areas of abuse and neglect, we have reached out to other counties that have already adopted policies. We took a look at several different policies. We picked through them to what we thought was workable in a smaller county or within our county. And then we also worked with Corporation Counsel to come up with the proposal that is before you. So again, this has been looked at by Corporation Counsel. The only thing that is missing, and that's referenced in my report, is based upon this new policy that's been adopted by Sawyer County Court. They are anticipating that the Adult Protective Service Unit will be doing comprehensive court assessments for private guardianships. Now, these private guardianships will be from individuals who have the resources to pay an attorney to do their petitioning for them, but the court has put out the expectation that our unit or a designee of the Adult Protective Services Unit will do the comprehensive court assessment. So in addition to the policy you have before you, we would like to add that there would be a hourly fee whenever we are court ordered to do a comprehensive court assessment. This would be at the end of page 5. So whoever is scrolling through, there is a cost. You will see their suggested fee structure so that when the county is involved and county resources are used to do a guardianship for an individual, whenever possible, the county will try and be made whole using that fee structure. But we would also like to add that when a comprehensive court assessment is ordered by the court, that they would use a rate of $125 per hour for staff time to do that comprehensive court assessment.
Okay, any questions, concerns? Lori, what if there is a situation where there is no money available?
Well, then it is typically goes to general county levy.
Okay.
Now, sometimes when a person is on a program, or if a person is receiving institutionalized Medicaid in a nursing home, there may be some cost share or
Still with us, Lori?
I don't see her.
She took off.
She's probably still talking to somebody. Yeah.
Okay.
Do you want action on this item, Mr. Chairman?
Yeah, I guess that's what you're asking for, isn't it, Paul? Some action? Yeah.
I looked at it and I thought it was appropriate.
I'm sorry, what'd you say?
Make a motion to approve it.
Okay. We have a motion on the floor to approve their proposed fee schedule for services. Is there a second? Well, I'll second it.
Yeah, I'll second it for discussion. Are we approving just the fee schedule or the whole policy? Or the whole guardianship policy?
This is the policy, so.
The policy, the fee schedule is in the policy, right?
Right, it is.
That's my understanding, yeah.
Okay.
There was kind of a moment of silence when I asked for a second. Do some
Well,
people
I-
have concerns? Excuse me. Do some people have concerns about this? Carol?
Yeah, I would have liked to hear the finish of what Lori had to say before
Yeah,
we
this
approve
one.
it, because I was wondering, supposedly the court orders it and it's an indigent person. Where's the money gonna come from for the assessment? If they're in a nursing home, aren't they already being taken care of by funding? I see, I don't understand some of this.
She said the money, if the person is indigent, would come from the county tax levy.
Okay, I missed that part, I'm sorry.
And if the person is in a nursing home, there's lots of different situations that could take place in there depending upon the age, the disability,
Okay.
other entities that are taking care of that person. So
Okay,
I'm sure the staff here would look for other funding sources. Go ahead.
I talked multiple times with Lori, though, so I could understand this. I go, what's the difference now between what's happened in the past? Because she had indicated, because it sounded like the judge was just starting to order this stuff and we had to do it, and they don't have, and she was saying, we don't have the capacity to do this.
right,
Am I gonna do APS or am I gonna do these court reports? And I said, what did we used to do? And I wish she was on because she could clarify this. My understanding is that there used to be a pool of people that the court, that we would give to the court, and they could go contact them and they would do the reports, and then the court would pay them. It would be a relationship with
that
them.
was the way I thought it was.
But now that resource isn't there for some reason, and now the judge is gonna order them for us to do. And one of Lori's concerns was, well, how is this gonna impact if we get, if we have a lot of APS calls or cases going up? What are we gonna do? Do we stop doing the APS investigation, or do we do it? And I said, I don't know where this could go, but it's gonna be safety first, and we'll deal with any fallout after that. That's gotta be the number one thing. So I don't know how this is gonna impact the workload, but I know she had some concerns about it.
Have we had a lot of cases?
That she'd have to
Yeah,
answer what a lot of
yeah,
cases
yeah.
is and how it ever
Yeah.
flows.
And,
It
you know,
depends.
I wonder, I respect Judge Shackle's decision to instigate something like this, but I'm agreeing with you. Just those assessments alone and getting all the pieces together is gonna take a huge amount of time. And it used to be, I think that, like they said, they had a pool of people that were trained to do this. And that's why I was asking about where's the training part for the people that assume this guardianship and who takes care of that and all the pieces that go in place to make this work. I don't think our staff, it's gonna add a big burden.
Well, it just did recently, because there was one or two ordered, and there were some APS cases, and she had to drop everything, and it's.
Yes.
And Lori can tell you how many hours it takes. It's-
And there's a timeline when the judge orders it.
Right,
I mean, you can't wait a week to do it. So if they have, their cases they're already dealing with, and they have a timeline on those by statute,
Mhm.
Yeah.
how is this gonna happen?
Well, wait a minute, it sounds like it already is happening. You said the judge just ordered some, and now you gotta take.
Yeah,
care
she
of
can
those.
tell how much, it's happening right now.
Yeah, so whatever we do here now, you're still gonna have that.
Right, but
problem.
I said, I don't know how, if we don't have the capacity and it gets ugly, and there's two competing interests, I said, I'll back it, it's gonna be safety. It's gonna be, if we miss a deadline with the court, I guess we'll have to deal with it. I don't know what else to do, but to me, safety's gotta be the number one thing.
Right.
Well, What's the alternative?
There is,
There is
Yeah.
no
You just do
alternative.
that.
You just do it.
yeah, and then we just deal with the fallout, I don't know.
Yeah, I mean,
I don't,
you can wring your hands all you want, it doesn't.
Well,
good.
In the past, this was years ago, but if I remember correctly, the judges would order a guardianship, but they would have a guardian ad litem appointed for that individual. And they would go through the process, but the courts paid for everything. The process was done, and then they selected someone who was trained to be the guardian of that individual. So I feel like, I'm gonna say it, I think we're getting dumped on big time.
Well, then maybe the best thing to do would be to pass this policy, which includes the fee schedule. So at least if we're going to get dumped on,
Okay,
which we are going to get dumped on no matter what we do,
Mhm.
we have an opportunity to try and collect some costs. So
You have words, you get your phone.
yeah,
Text her and tell her to turn on.
I don't have her,
She might, there's a phone caller on it, might be her, but she's not saying anything.
what's the number? Yeah, 934.
934, 9046.
That's her. That's her.
That's her.
Yep. Oh, I got the number. Right next to it.
Did I just hear something?
She's not. Lori, could you speak?
No, I'm good.
No.
That was Joey, was it?
That
I'll
was.
text her.
That was Joey.
I'll text
Oh, God.
Here,
Yeah, but she feels okay.
I'll text her.
I didn't mean to throw a monkey wrench into that, but this is a big.
Yeah, it is.
I think she was getting to that point. That's where she was, that's the conversation. We've had multiple
Yeah.
conversations about that.
I've been through a few of these and it's not easy.
Quite a few years ago, I went through something similar.
Yeah,
The judge looked at me and said, "You're the guardian." I said, "Okay." That was it. That was all there was to it.
oh, really?
Yeah.
Oh. Hmm.
There's some, yeah.
All right, can you guys hear me again?
All right.
Yeah.
Yes.
All right, sorry about that. I don't know why I lost power. So I heard part of your conversations on the phone while I was trying to get reconnected. So historically, again, they were correct. When a private guardianship came through, we would provide a list of names of individuals who had experience doing comprehensive court assessments. A lot of times it was retired staff members. Linda Seeger, who works as an information assistance specialist, will still do them on her own time. So we do have a list of people available in the private sector who are able and willing to provide this service. But as Paul pointed out, this could put us, and I also put the notes in my report, this could put us in a real bind, because typically when this court order comes through, we may only have 2.5 to 3 weeks to do a comprehensive court assessment. We've had 3 orders now in less than a month that we've had to scramble to try and get done. We had to ask for a continuance on one of them because the way the order was written, we didn't even realize that the department was being ordered to do the comprehensive court assessment until 2 days before the hearing. The last 2 Rose did, one took 7.5 hours, another took 5 hours. But that's when everything goes well and we have easy access to things like medical records. And I would say, having looked at one of them, they're not as good as it should have been. But then again, we didn't have time to get it done in the way it should be done in the time frame we were given.
So could we still hire outside entities, people that have already been trained in this to facilitate some of this? Or does it have to come through this department by the judge's order?
The judge's order says our department or its designee.
Okay, there we go.
But where do we get the money to pay somebody to do it?
Well, if it's
The hourly rate could be turned over, it'd have to be a pay schedule for the person doing the work for this department, if we have people that are available to do it. I'm worried that it's gonna come down to a crunch, and with the statute limitations of the timeframes, the judge is gonna get upset, and then we're gonna have this other situation over here where we have someone at high risk, and we don't have the staff, period. And safety should be first, but this is gonna be a burden. I'm outspoken, I'm sorry.
You have experience.
Does anybody have any suggestions on how we proceed?
If we
from
have
here?
an attorney that's gonna act as the guardian ad litem and put all this in place with a person that we can pay through this hourly wage and take some of the burden off the staff, I mean, I could see it working then. But
Boy, you got any ideas?
and like Lori said, just getting the medical records in a timely fashion, that's a nightmare sometimes.
Laura, are we still having somebody look into to what extent we have to do this?
Yes, we have asked Corporation Counsel at Von Briesen and Roper to give us some information to look at, to what extent the judge can be ordering other departments to do specific tasks, but I have not had a response yet. The person it's assigned to has been out of office. So we're waiting for information. I believe Tom had also reached out to some of his people in this 10th district to see if this actually is common policy or what the genesis of this new procedure is. I don't know if he's received any responses.
I did ask Court Administrator Channing, and I have not heard back from him. I'll follow up with him again as well.
Well, in light of this discussion, I'm going to rescind my second. Dale, do you want to rescind your,
I'll withdraw my motion.
withdraw your
We
motion?
can table it for a while
Yeah.
until we get more
And
information.
let's talk about this again next month. as
I don't
well.
think we're gonna get anywhere, to be honest. I think it is what it is. You know, it's a
Yeah, I
lot of
think we're
work.
gonna-
and it's
we're gonna end up-
something-
And that's why I say if I thought it was time sensitive, I would have suggested we go ahead and pass this, just so we make sure we can get a fee schedule in there. But it sounds like we're gonna have time to deal with that. It's off until next month. Just general consensus, is that okay with everybody?
Yes.
Okay. Let's go ahead and move on.
Paul, may I ask?
Chairman?
Yes.
So just so that I'm clear, right now, we need to find a way to recoup some of this cost for the department. So with the ones that have already been court ordered, we are submitting a bill because part of the policy says we can charge for this.
Right.
So
Who are-
are we out of line?
Who are you submitting the bill to?
It goes to the court. So when all of the paperwork is submitted to the court. So the comprehensive court assessment is submitted, and then we are also submitting a bill at that rate of $125 an hour just to make the department whole. Because if we're not recapturing any of that cost, that is all coming out of county levy. So that's out of the taxpayer's pocket to do something for an individual who has the resources to pay for it themselves. So are we out of line by, even though it has not been adopted, to be trying to recoup some of the cost?
I'd say no,
No,
I
we're not out
don't
of
think
line.
so. They put the time in and
right?
it says right here,
Yeah.
the judge's order. So send the bill back to the courts and see what they do with it.
Thank you.
That's my opinion.
Yeah, I would agree with that.
And that was part of the purpose of having this policy, was that the state had told us if we're going to be charging for things, if we're going to be taking the position that when and where we will be doing guardianships, we do need to have something in writing. So that's the purpose of having this policy before you.
Then you need it adopted tonight so you can go ahead with it. Can we put a caveat in there that you do have the right to seek outside expertise to follow through if your staff can't do it?
Well, it already says, or they're designated.
Yeah,
So that's in there.
all right. Now, I'm willing to approve it then, because then we can send it back to a charge for the services, but I'm still worried about the staff getting stuck with too much work.
Well, we're gonna have to deal with that in the future
Yeah.
too.
And then I guess we'll just report to you every month where that's at, and then if it gets really bad, we'll brainstorm what we're gonna do.
Okay, so in light of what Lori said,
She needs a motion so she can go through the billing and the process then.
How have we not been doing this before?
The courts did it before. That's
This
why I
all
was so
happens in the
surprised
court
when this
system.
came to us.
Health and Human Services was not involved.
Mr. Chairman, can we ask, Tom, can you still hear us?
Yes.
Would we be out of line approving this tonight and then hearing from our attorneys after?
Yeah, we do have, I mean, we've been conversing with them. We do need that answered. I'll follow up with Channing again. If you did pass this tonight, you can always change your mind next month or update it with any new information we come up with in the meantime. So I don't see a lot of down in adopting it tonight, because you can always change it next month if need be. But it would allow Lori to charge for the ones that are occurring in the meantime.
Okay, I'm fine with that.
Mr. Chairman?
Yes,
So again, really, these are two separate issues. The guardianship policy has actually been in process for over a year. The only change we are asking that could be affected by what the court is ordering is just having that additional charge for a comprehensive court assessment at that $125 a rate. Otherwise, they're kind of separate issues. We're going to either have to do what the judge orders or we're not. But that's related just specifically to a comprehensive court assessment. It's not the entire guardianship. This policy before you is putting out and codifying when the expectation will be that the county will assist with the guardianship, the full guardianship, not just the comprehensive court assessment. When we would be assisting with a full guardianship and when it might be referred to a private attorney. And if the county is going to assist, whenever there are resources available, the county will try and recoup some of the cost based upon the fee schedule that's attached. Is that helpful?
trying to put that into a motion is, no, it's not real helpful. Where did you get the number $125? Where did that come from?
We looked at what other counties have charged us in past years when we've asked them to do, for example, a comprehensive court assessment or the similar Watts review, which is also a report on the condition of award. So based upon what other counties have charged us historically, what Adult Protective Service social work get for that type of services. And Patty had also recommended, we ran it past Patty, and she said it would be, they're justifying $125 an hour is very reasonable.
Okay. Does anybody want to try and make a motion?
Carol?
So what we're asking you to approve is the policy as it appears with the addition of a J under the fee schedule on page 5, and that J would be comprehensive court assessment, $125 per hour.
Okay, I can go along with that.
So you're gonna make the motion. You get that?
I think so.
Yeah, and I'll second that.
And a second from Mr.
Yeah.
Schuman. Any further discussion? Everybody in favor, say aye.
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 Anybody opposed? Motion passed.
Thank you.
You,
Thank you,
Good
Gloria.
job, Chiefs.
Okay, the behavioral health report, you have a report from Alicia Carlson before you. I'll highlight one thing just for the sake of time. Please note under CCS, we got our payment for the 2020 WIMCR of just under $79,000. So the money's coming in. Takes a while.
Yeah,
Good to see.
yeah.
Also, you have your usual mental health cost by client report that Cindy Hannes puts together for us. Okay, Child Protective Services, you have a case report in front of you, and also the substitute care report, where all the costs and the places where the kids are placed. I also want to add, that's not in this report, is we were able to hire another worker, and it's going to be, this worker's full-time. She just started today too. It's half CPS and half youth justice. So now we're just down a youth justice social worker, and we got to get another social services aide. So we're closing in on a unit.
Okay. Who was that person?
Robina Elliott, Robina. And Elliott. Okay, and then you have the YJ report, caseload report from Carla McKay. And then economic support, pretty much the same report you get every month about how well they're doing, and they keep hitting high marks on the timeliness. Public health.
Put in a report for birth to 3 services. I did a little background just because you guys haven't seen much coming out, and we have just to get you back up to speed with how birth to 3 is working and the services that we're looking at. One of the things that we're going to be focused in on that I made point on is the 1,000 First Aids program, trying to make sure that we get referrals in early for any potential developmental delays. So that's going to be what we're looking at this year. And then update on tourist rooming houses. Matt pulled together some numbers for us, and you can see how we are growing. So definitely keeping the guys very busy in those programs. Does anybody have any questions on those? Jump into your COVID report if you don't. Over. Okay. Okay. They can hear me well enough. Okay, so numbers are up, ladies and gentlemen. If you don't know somebody who has been sick with COVID in the last week or so, you are probably in the minority. So we've had quite a few cases. We are up to where we were with our high back in the fall with Delta. We now know that we're confident that this is Omicron that we're seeing. It just was a clear shift after Christmas. In November, we didn't really have that jump after Thanksgiving. We didn't have the jump in cases. We hadn't historically seen that from a holiday. Definitely did see that this year or this season. So just some quick pictures on where we're at. Obviously, everything's red and dark. And then we are showing a 30% positivity rate when we look at all of the cases. And I know LCO has been getting some really high numbers out of their positivity rate. This just is to show you that that dark red spike here, I don't know if that's really dark red burgundy, that is the Omicron that we're seeing. And the pink is when Delta had taken over. So Omicron is definitely taking over quicker than Delta did, which is why we're seeing so many people out. One of the positive things is at this point, our local healthcare system is not nearly as overwhelmed as the last time I was talking to you guys about this. And we're seeing that in the Northwestern region that the cases are coming down in the hospitals. It's a little bit easier to transfer patients out right now, but one of the things that's still happening is there's a shortage in long-term care, so the nursing homes and rehab, which is causing patients to stay in the hospital. I don't know if you guys have heard, but the National Guard that we were using for wing testing or COVID testing has now been redeployed and getting trained to go into nursing homes. The idea is to get more staff in there because they do have beds, they just don't have staff. So trying to free up or get staff in there, get those beds used so we can free up hospital beds. So that's the transition that's happening.
How's that working? Have you heard anything?
They're
Any
just
results?
starting to train in December, and we expect those deployments to be happening soon.
That's here.
In Wisconsin, yeah, throughout Wisconsin. So it probably won't be local, but at least it's places to send people to, so.
Right.
Julia, is that a burden on the patient then, or their insurance to keep them in a hospital bed versus a nursing home bed? Or does it
Actually,
hurt
no,
the facility?
it's a real burden on the hospital, because how hospitals get paid is they, you guys have heard of ICD-10 codes, or there's codes that you get your billing for. And so really when Medicare pays back, they just pay on one set of time. So say that somebody, I don't even know what the rate of days would be. So let's say COVID days are 7 days. That's the expected time. And then that's kind of one lump sum. If you have a person that stays less than that, great, you make money. If you have somebody that stays longer than that, too bad, you lose money. And that's how the hospital system works. So hopefully I explained that in a way you could understand. You're lost.
I had just heard that the way they code these, especially like deaths, that they are mandated to code deaths if they have COVID. The guy was saying, and he's a doctor, that if you come in with a gunshot wound to the head and you test positive for COVID, you're a COVID death. And hospitals are getting an amount of money for.
They don't get paid for people to die.
There is no financial incentive for a hospital to have a COVID patient.
I would not think that I mean, yes, I would think that they get paid more for a COVID patient. Do they actually make money on those? I would say absolutely not.
But they're getting.
Well, they're getting paid whatever the code is. So whatever the code. So if you go in with if I have you down for heart failure, or you're in for heart failure, you're getting paid for whatever that ICD-10 code payment is. So if you go in and you have COVID and you're getting treated for COVID, and they can mark you down as an ICD-10 code, so that's billing versus death. So I mean, we're getting into way more stuff. Maybe we want this after this meeting. And I'm not sure on the other, being forced to say that it's COVID related. When you do deaths certificates and when you do a hospitalization, when we look at those, we look to see if they're actually treated for COVID, not that they just had COVID. Those don't go into our numbers anyways. We clean that up. So I just want to clarify that. Okay. Oops, I think I'm stuck. Oops, there we go. Okay, so the other thing that I wanted to just say about the jump right now, we haven't seen the spike with Omicron either with the hospital rates. So it's a little early in it, but when we look at this one graph that I have down with the different colors, we can see the big spike up. This is through Johns Hopkins, and what's good is it's a big amount of people. So you can see the big spike up in cases. The pink is the slight amount of rise in admissions with COVID. In the ICU is even lower yet. When you follow that going back, you can see that they were pretty well identical. So it's helping us to believe that hopefully Omicron is not going to have the severity. The scare that we have for the hospitals is just that even if it's a very small percentage that goes to the hospital, it could overwhelm the hospital systems. So we're just going to watch that closely. At this point, where I think the concern is just the number of cases and staff being able to staff the hospital at this point. But I haven't heard that they're having problems with that, but that's what we would want to watch for. This just follows really, Lorraine, what you were saying. The unvaccinated cases to the fully vaccinated, the number of people who are getting in, you kind of already reported out on that. big change that's happened over the last month, since we talked last, is the new isolation and quarantine guidance. I did give it to you guys as a one-pager so that if anybody asks you, you have something to refer to. So new thing is anyone who is tested positive, you should isolate, stay home for 5 days. We are hopeful that some people will have very mild illness and will begin to recover, and then they can go out in public, leave their home and wear a mask and go around. We're expecting that by the time 5 days comes, you've gone through your biggest time that you'd be shedding and you're most infectious, and towards that end, we shouldn't be as infectious. So that's why we have this change. It's kind of very confusing for people. Yes.
Are employers still paying their employees to stay home?
Oh,
Was it on quarantine? I remember, was it during CARES, the initial COVID, there was 80 hours of pay that was.
yeah, I
Are we-
don't know that there's
No.
CARES Act dollars. Anybody know that
I don't
answer?
think- I don't think we're doing it with the county, no.
Yeah,
'Cause
so,
We're doing that, right, Ryan? At the tribe.
Yeah.
And that's getting to be tough.
it's getting
Because
to be
people are
tough.
getting quarantined and quarantined.
Quarantined
and getting
again,
paid
yeah,
for all
and
this.
yes, and I know that we don't have that, at least for us as
Okay.
employees, so. And then the other piece of it is quarantine has also changed, and it's gotten very complicated, so that's why I just gave it to you as written, but, so if you have been boosted or have received your primary series within the last 6 months, or J&J within the last 2 months, the recommendation is to wear a mask. So this would be a close contact, and then test on day 5 if you're able to. And then if you've had your primary series over 6 months and you have not been boosted, and then they're asking you to stay home for 5 days, wear a mask for an additional 5 days. They do have the caveat in, if you can't quarantine, you go out and you must wear a mask for 10 days. So I put all of those things in, so it's a little complicated.
We have a situation with a worker's ready to come back, but the worker's child was exposed to somebody with COVID. So is a secondary exposure, I mean, does that person have to?
Well,
And I
that's
said, well, if you come
because,
back to work, she talked to some of the nursing staff and it was
Oh.
like, well, I said, well, you come back, wear a mask.
yes,
So I said, I don't know.
that was definite thing. And some people are having to stay home because they have to stay home with their kids.
Yeah.
And
Right,
that's
right.
the other
Well, this
piece of it.
person's child doesn't have any symptoms.
Oh, okay. Well, we'll figure it out.
All right.
How long do these vaccines, I mean, people who've gotten vaccines have gotten their boosters, okay, so we're good for another 30 days beyond. How long are these boosters gonna be good for? Because everybody's probably running into almost a year now, because if you got them in February and March last year, that's a year.
Yep, then you get your boosters in the fall.
Mhm.
So I don't have anything out there that says this, but I would not be surprised that it would be a every 6-month booster.
So not the vaccine particularly, but another booster.
Another, yeah, so you'd
Okay.
start, and basically it's the same thing. You're getting the same
Yeah.
vaccination, but
Okay.
yep, so you'd get so you have your primary, everybody is eligible now 5 months after their primary series to get vaccinated. And then I would not be surprised if another booster comes in. And eventually, and really we have to figure out how we're gonna live with COVID. We have to
Yeah.
figure out how we're gonna move forward. This is not going
Yeah.
away. We need to, figure out, manage, move on. And, when we're sick, stay home. Hopefully, it's gonna be like influenza. It's going to be what we call endemic, where it's gonna come up at periods of the time of the year and wane at other periods time of the year. And it's just our new way of living,
Our new normal.
our new norm.
So do you have an idea how many people are vaccinated now?
Yep, 57%.
57 for the county?
Mhm. This is just age distribution. We had less cases in December. And so it was pretty even across the board. If you think about the number of people we have in the county. So the green line is just looking at December. And then we did do pull together. I know the county board was interested in our death data. So would be interested in feedback that you have on if this seems like that would if you have any questions on it so that I can get those answered before I send it to the county board. I'm gonna just send it in an email to them. So we've had 51 deaths since the beginnings. That's through December. We had a pretty, and this graph just shows the pretty sharp rise in December when we had a lot of those hospitalizations, and then the age ranges in the deaths.
And that's the whole county, right? The
It's a whole
tribe and
county. It
everybody?
includes the tribe, it includes everybody. Mhm. And this is hospitalizations. We've had 178 reported hospitalizations. These are not necessarily happening just in Hayward. People from our county can be hospitalized and all around our areas. So that's kind of the breakout of numbers that have been hospitalized. As you can see, 60 through 80 or through 90 even, that area is definitely people who tend to get hospitalized. So that's where getting that booster and being up to date on vaccines is important.
Who's the youngest? You know?
I can't give that. I can't stretch in.
Yeah.
So
I'm just curious.
getting into too much HIPAA data.
Yeah.
So. And then just another kind of breakout. We did a poll from March 2020 to March 2021 because that about the end of March was when our really high risk population was fully vaccinated. So pulled it this way just to see the numbers. And so the average age of a case in March to March was 48. The average age of a hospitalized patient was 72, and the average age of somebody who died was 80. And then from April to present, the average age of somebody who gets COVID is 38. The average age of a hospitalized patient is 64, and the average age of somebody who dies is 74, 75. So it's kind of where we're at, just to give a little
Some of
deeper
our
dive.
tribal members are young.
That is
Yes.
wonderful.
There were some.
Yeah,
young.
very,
Well, it's
very young.
associated with comorbidities, correct? Julia?
Yes, yes.
Well, some of them
And if you have,
didn't have
if
any
you have a
other-
higher incident rate of
factors.
diabetes and COPD, and you're gonna.
Mhm.
Mhm.
But some of them didn't.
Yeah, and
But
some
they were
don't,
young,
some
yeah.
don't, some don't really have what we would think would be,
Yeah.
and that's the unfortunate piece with
Yeah.
COVID. So
But
here's
Julia,
your,
they're probably learning that vaccinated results in fewer deaths.
Yeah.
yes,
That's a
that's a given.
known fact.
Yeah.
Okay.
Mhm. Here's your data, 57% of it is vaccinated. Vaccine clinics. For sure, LCO all day Wednesday. That one is going to be a given all the time. I know you gave some more hours, but I think those are not always set in stone. So we kind of advertise out for Wednesday. And then for us, we are moving to a company called AMI. It's a state provided resource, kind of like when we were using National Guard for wing testing. They have a company that's coming in, and they're going to start vaccinating for us on Thursdays. And that is going to be back in our building here.
So is it all day Thursday here?
No, it's gonna be 10:30 to 2. If we fill those slots up, we will eventually extend that, but at this point, that's kind of what we're gonna try and see what happens.
Does they have to call, make an appointment?
Yep.
then?
And Lorraine, I can send you,
Yeah, I appreciate that. 'cause
This flyer.
Some of our people live out here, some are LCL and some, they're all over. so-
and this flyer is the one I did for both LCO and
Good,
for,
thank you.
so it has all the information, so I'll email that out.
Julia,
Yes.
is there, what cost was there to the county to bring this group in?
There isn't, it's a state provided resource.
Right, okay,
Yeah.
thank you.
It saves us paying staff to help
Yeah.
support the programs, so it
Yeah.
actually saves us money. So very happy to take them up on that resource. Good question, though. It's not, yes, good question. And then we are continuing to do testing, and you can definitely see where we kind of dipped down in December with cases and testing went down, and I was thinking, yes, we are going to be able to get out of this testing program. But just in the first week and a half of January, we're back up to averaging 35 per day. We've already done 242 people in those days. So definitely not getting out of the testing.
Of the people that come in, how many are mandated by an employer to come in and get?
Very few.
Okay, what, like 90% or
Most-
10%?
Oh, 2%? I mean, it's very few people come in. They would come, there's a few people that come in regularly. And I'm thinking, you know, like a handful a week. So, yep, most of these people are coming in testing because they've been exposed or they've got family members who are sick. And we do help the hospital out because they do have to do testing. And so really the ones that we're seeing is there. The only other ones that are really mandated would probably be LP, I'm guessing, because of their size, but they have an occupational health nurse there. So they're doing their testing.
Federal employees, so that would be Forest Service, Park Service, all those folks.
Not really seeing those. So I don't know where they're getting testing and what kind of programs they have in place, but we would prefer that their businesses figure out how to manage that because we cannot be the ones that take care of this for businesses.
A lot of people are buying those home tests now.
Yeah, and they might even have those at the place of business to be able to just watch them and test them. That would probably be an easy way to be able to do that because you wouldn't need a waiver. They're just basically a home test. So I'm really not sure. Nobody has contacted me to say I need to have my employees coming here to get tested. So, let me see. The only other thing is there might be questions on Berkey, and that is still looking like that's going to be happening. I know that they're watching everything really closely to see what's happening with medical services. I do know that they're going to have masking in all areas that would be enclosed. They have set up a special race that would allow people to have more distance from one another and kind of just working the best they can. We also really are looking at the way the numbers are growing with Omicron. It's a good chance we could be on the decline by that time. So that's my update. Long one, sorry, tried to make it fast.
Julia, you said we're gonna have to learn to live with COVID, right, going forward? You
Yes.
see then that we'll probably be doing less testing and
The future.
only if we're symptomatic and feverish, kind of like they treat the flu now, right?
Mhm.
Is that what you see?
And I would envision this to be more you taking care of it on your own, and then when you would normally go in to get tested for influenza or concerns because you're not getting better or that type of thing, or the home kits are going to be available, and that people will continue to kind of check themselves that way. So.
What was alarming to me was the United States was #1 now in the world.
Yeah,
To me, that just stood out like, oh my God, why
Yeah.
is this happening when we are an advanced country?
Very hard to stop
Yeah.
something like this. The good thing that we saw is that those other countries that it really jumped in quickly. It did kind of work its way through fairly quickly too. So that's what we are anticipating with this
Yeah.
one.
Crazy.
I wish I had a magic ball
Yeah.
to answer all the questions.
Thank you. I think
Yeah.
you do an excellent job for us.
Yeah,
I do too.
Thank you.
I do too.
I'm done.
Okay. Marvin's report. Recap report. Recap. Future agenda items, I think we've got a couple that we decided on already.
Yeah, there's,
Future
next month,
agenda.
you want to present your public health report?
Yep, this month we'll have the community health assessment that we'll be bringing in and letting you know what the plan will be for the coming few years.
Any other matters for discussion, conferences, reports?
The national level did declare the month of January sex trafficking awareness month. That has come through. So just want to keep educating and keep the awareness and keep protecting and everything.
Well, you just broke up that one big ring over there in Minneapolis, which is good.
Yeah, yeah,
But it's interesting how many high-class people were involved.
yeah,
Yeah.
yeah,
It's a terrible thing.
yeah, it is.
Okay, we're adjourned.
Great.
Yeah.
So you want to zoom in, Joey, then at